And now to our local children and school. Vanderburgh County posted 145 new COVID cases today. Those numbers running high for about 3 weeks now. That's prompting the Evansville-Vanderburgh School Corporation officials to raise concerns over the likelihood this school year can remain in person. Joining us now is EVSC Chief Communications Officer Jason Webkenberg. Thank you so much for joining us, Jason. We appreciate it. You know, my son graduated from an EVSC high school last May, and I'll tell you, I was amazed but very happy that EVSC students were able to stay in-person learning all last year. But at yesterday's school board meeting, Superintendent Dr. David Smith hit the board with his statement about his concern that in-person learning won't be able to happen this full school year. Explain what's driving that statement.
Well, it's good to be with you, Shelley, and you're right. Dr. Smith did make comments last night. It's interesting to hear your perspective from last year, and I think all of us agreed so much pride in keeping our schools open. And, you know, we were so hopeful that this year that we would almost be able to put the pandemic, so to speak, a bit behind us. And so far as the numbers you're reporting, that is not the case. And the numbers have risen so quickly and so early in the school year that it has raised cause for alarm. And I think we want to just make sure people understand we're going to do whatever it takes to keep people healthy and safe. Our ultimate goal, besides keeping them healthy, is to keep schools open. But we may have to add additional mitigation strategies, and we may have to consider making decisions that we certainly don't want to have to be in a position that we're forced to make.
In Dr. Smith's comments, he discussed high school football games. There are no limits on crowds this year. Last year, it was severely limited. Talk about the concerns for the football season and other potential extra events, the curricular events that could be going on.
Certainly. Well, you know, one thing that we have the advantage of in the fall sports season, all but one sport, volleyball, take place outside. But right now, as you said, we do not have capacity limits. We did that last year. We had considerable reduction in our stadium capacities. That was done, of course, to keep people safe. We were optimistic we would not have to do that this year. So far, we have not. But when you look at the numbers across the entire county, and we're a countywide system, so we reflect the numbers in the county in terms of being in this community, it does make us think at some point we may have to consider reducing the capacity in those stadiums because we simply have to do whatever it takes to prevent the spread of the Delta variant of the virus.
No doubt that's one of the mitigation efforts you just talked about. What are other mitigation efforts that you may have to put in place that you're talking about?
Well, obviously, we've already changed the mask requirement. And, you know, one thing Dr. Smith shared last night, and we're certainly not trying to do this in a doomsday approach or to sound alarms that aren't going to come to fruition. But, you know, one thing we would hate to do is to go virtual because we know that students learn best in an in-person setting with their friends, with their peers, with a teacher in front of them. And we will do everything in our power to make sure that continues. But if the numbers continue to go up, we may be forced to looking at going virtual. And we know if that happens, then extracurricular and athletic events come to a stop. Children have to stay home. Young children will need someone to stay home with them. So the ripple effect that has on the entire community, not just our students and employees, is tremendous. So we're just asking everyone to continue to cooperate, to do everything possible. One of those key strategies is to make sure you screen your child in the morning if they're showing any symptoms whatsoever, even if it looks like an allergy, that could be COVID, please keep them home.
How close are we to that decision of possibly going virtual? Like, what do you look at? Is it just the numbers that you're talking about here, or are there other things you take into consideration as well?
Well, Shelley, that's a great question, and we've been asked that before. And, you know, we don't have just a set number in mind that if we hit this, this will happen. But I can tell you, as we've done all along, we're going to continue to follow the numbers. You know, they are very startling. If you look back to June, it was almost minimal, and then July got here, and we're almost seeing those numbers continuing to double each week, and now they've just grown tremendously here in the last week or so. So we'll continue to look at that. We'll continue to talk to our local health experts. We're blessed to have so many community partners that have expertise in health, Vanderburgh County Health Department, hospital officials here locally. So we'll continue to talk to them as well, and we hope the numbers don't continue in that trajectory where we're forced to make that decision, but we've got to keep everyone safe. But again, our ultimate goal is to keep schools open.
All right. Jason Webkenberg, Chief Communications Officer with the EVSC, thank you so much for joining us today. Appreciate it.